Gordon, can I turn to you? You've clearly worked with the Chinese government on health and hospital reform. You're familiar with the trade-offs that governments have to make across lots of competing priorities. How would you be advising either the Chinese government or other governments about how to strike the balance between investing in preparedness for something rare but potentially devastating like a pandemic, or more pressing everyday needs like primary care, hospitals, or even schools or something like that?
Thanks, Peter. It's a great honor to be here joining this workshop, and especially to join a panel with ministers from Africa. China still shares many similar conditions and characteristics with them. I'd like to offer 3 points and one case in this question. I mean, how to balance public spending on multiple demands, in essence, is really a fundamental economic question, right? In the management of public finance, it is always a central task for government to optimize the allocation of resources following economic principles such as cost-benefit analysis of multiple needs. So in other words, here the guiding principle is value for money, as we discussed extensively yesterday, which is extremely important. Whether we are talking about the resources for ordinary needs in the long term or pandemic demands in the short run. That's my point one. And the point two is about the practice, where decisions are not always an economic consideration, but a mix of political and social considerations. For example, in the long run, when you deal with budgetary work for ordinary demands across sectors, different populations, economic principles, as I laid out earlier, can be better followed because simply we have more time, right information, right? But when we're talking about short run, dealing with pandemic crisis, you don't have much time. So in this case, political and social considerations play much more roles due to urgency and public pressure, often leading to misallocation and misuse of resources. In this regard, although underreaction or overreactions could both happen, but in my observations in China, I find the latter, the overreactions to pandemic or massive crisis, dominate. I'll give you examples, especially in societies where government roles is more central, like China. In 2003, China had a SARS outbreak, followed by 2008 earthquake in Wenchuan County, where I was born. And H1N1 and recent Tianjin explosion recently. We find that the reactions to these events end up with massive misuse of resources in terms of goods that are donated, provided by government or private entities. And even for the earthquake in Wenchuan County in 2008, for 2 or 3 years later, when you go back to there, you still see some unpacked boxes of goods and services still out there. So I want to just call people's attention when we are talking about reactions to pandemic threat. Okay, it's not always the underreactions dominate our process. The other side of the problem also quite significant. That's my point 2. Now, point 3 is about what to do for better outcomes. In dealing with the pandemic or massive urgent crisis, in the short run, I think no matter how we prepare in advance, I think we will always face chaos and challenges where we must do whatever we can. But it is always, in my view, it is always beneficial to construct long-run institutional policy settings, as the minister said, which is very true in China, whenever we can. Why? Let me offer you why. Why the institutional settings in the long run is important. Well, we're all maybe subject to a famous curse by economist Maynard Keynes, who say, in the long run, we're all dead. Why cares? But don't ever assume no connection between long-run constitutional policy setting and short-run reactions. I strongly believe there is a strong relationship between long-run institutional settings and how we react to urgent events. Let me now offer you a case in China. Started in 2009, when Chinese government began to implement a massive interventions to establish a national or universal health insurance coverage for the entire population. But the universal insurance coverage is only, or can only cover what we call the basic or essential care. Basically, it's primary care services. 5 years later, today, 97% of the population have been covered through the universal insurance policy for essential or basic care or primary care. Now, we know in the course of healthcare delivery, there is always some crisis or catastrophic events occur to individual families. What do we do? Well, depends who to use the insurance, where to use the insurance. Some people get more than necessary. Some people don't get enough support from the primary care insurance coverage. Okay? What does tell us is, because we use a universal insurance coverage for primary care to deal with catastrophic event, which is rare but big. So we cannot continue to use this primary care insurance coverage to deal with the catastrophic insurance. So now, starting this year, government said, look, we can't mix primary care insurance and catastrophic insurance together. We have to build a new insurance specifically to target catastrophic problems for families who will have those problems in the future. So starting this year, we begin to establish a catastrophic insurance, which is separate from the primary care insurance. And the premium funds are drawn from the residuals, the reservations from the insurance, primary insurance funds. So that individuals don't have to pay anything out of pocket for the catastrophic insurance. The premiums are from the residuals from a primary insurance coverage. The difference between these two policy settings is, whenever people experience a catastrophic event, we have something guaranteed that will be used to deal with the catastrophic event for those families in time. And in the meantime, we make sure no more than necessary funds will be drawn from primary insurance pools. So this is the benefit of having institutional policy settings to ensure our primary care policy in the long run and also have a good reaction to catastrophic events in the short run. So that is my observation in China.
Thank you, Gordon. You talked about overreaction and underreaction to things like pandemics. And governments obviously face some quite difficult trade-offs when something like a pandemic is emerging between taking action to control the spread of the disease, but also not wanting to cause unnecessary economic or social disruption. And they have to sort of balance those considerations, often in a very uncertain environment. How can governments get that right?
Thanks, Peter. I appreciate this question was raised to me earlier, so I give some thoughts. I wish I have a good answer, but there's no good answer for such a question. However, I think it is always good to distinguish two types of disruptions in dealing with pandemic events. One type of needless disruption is caused by government. Why? Because in facing the choice of controlling a disease and disruptions, think about there will be two types of mistake a government can commit. Failure to control the disease, which is very visible and accountable, which is in statistics we call it type 1 error. Another one is the failure to limit needless disruptions, which are very hard to measure as whether or not it is needed, which is what we call type 2 error. Now, regulatory economics tells us already that if a government officer is facing these two types of errors, there is a tremendous incentives for government officers to maximize the risk from the type 1 error at the cost of type 2 error. Therefore, their overreaction would be well expected, if possible, because otherwise they can be held accountable for type 1 error, which is visible. So in this case, the best way, I think in theory at least, is to improve institutional settings, again, for better governance of government people's behavior. Now, there is another type of disruptions which is made by the public. Now, public disruptions are mainly caused by fear and panic, okay? Mainly due to the lack of knowledge or misinformation about the pandemic event. In this case, in my view, and based on my observation as well, one of the best strategies that a government can do is to disseminate transparent and right information to the public at the earliest time possible. But this is not easy to do. In the Tianjin explosion event that occurred two weeks ago in China, government wasn't so sure about the cause of the explosion, so they were so hesitant to tell the public what went wrong. Then the rumors arise, and there's so many misinformation going around, politically, economically, socially. At the end, of course, the government will have to come out to say what is the right cause of the problem, what would be the right approach to deal with. But it seems to be a little bit too late. We could have prevented some of the problems that rumors caused it. So I think my advice is the government really should have the courage to come out first to release whatever information you can have. Of course, the scientists sitting in this room should have the responsibilities. We should just not wait until you have no risk at all to tell the public. Everybody bears risk. We should do something before the fear and the panic and the rumors occupy our society. That's my observation.